government back in the day and ranging to see, what the room looks like, and also what experiences people haven't had to know who to advocate for as well, So it's really, really important that we have people in these high-profile jobs. So we're going to have a panel now, and I want to just set the tone. What percentage, this can be another poll very quickly, what percentage of people in Africa and the Caribbean are pushed into poverty each year because of out-of-pocket health expenses? So what percentage of people are put into poverty each year because of out-of-pocket health expenses? A, 5%. Any 5%ers in the house? Raise your hand. Okay. B, 10%. C, 15%. One there. D, 20%. Some of you, again, are scared. This is not Ghana where we say, shame. There's no shame here. Okay. The answer is D, 20% of people. 20% of people. That's remarkable. Because it means that after they could be saving all their life, all of a sudden, someone's ill, and all that goes just on paying. Also in America, very, very similar stats in America. So, as we know, across both regions, Africa and the Caribbean, millions are forced to choose between treatment or survival, and climate shocks are making it worse. And that's why it's very important we have equitable healthcare. It's not just moral, it's actually economic and resilient strategy as well. So we have a panel to look at how do we build equitable health systems across Africa and the Caribbean. And we wanted to go big, so we got a great moderator. So please welcome the chair of ACSIS, David F. Roberts, to be the moderator. Please come to the stage. And my panelists, Steve Maingott, Dr. Nicole Lawrence, and Dr. Stacey Bryan. I've got PhD envy. Am I seeing Steve Maingott? Are you here? Oh, no? Oh, here we go. Cool. Dr. Nicole Lawrence and Dr. Stacey Bryan, if you can come to the stage. Welcome. And I'll be sitting here flashing you with times so we can get lunch in our stomachs at a reasonable time. Thank you so much.
It's always an honor to be a part of these exercises. The only difficulty is, because today is what it is in terms of why we're here, I seem to be at the center of all the problems and solutions today. So don't be surprised if I get called away because something of an urgent nature takes place outside. So we've got two prominent individuals from the medical profession with me. We're going to be discussing a topic that I believe is paramount at this point in time for the African Caribbean space. So what I'll do is I will let the speakers introduce themselves and then we launch straight into it.
Thank you. Good morning, everyone. I'm Dr. Nicole Lawrence. I'm a registered dietitian, nutritionist by training, and a doctor of behavioral health. And I really want to work with people to make them healthy, for those people who are underserved, to bring them to a status where they can take care of themselves and they can take care of their families without a whole lot of stress. And so I'm happy to be here with you. I'm happy to have this conversation on health equity. Thank you.
Greetings all. I'm Dr. Steve Mango. I'm a health informatics specialist. And you may ask, who's a health informatics? It's a conjoined discipline of clinical and technical. So during COVID, it was demonstrated by the data and the graphs, and so you saw, that is health informatics. So what I do is I look at data and transfer it to information and intelligence to help inform healthcare delivery and planning. That's it in short.
Great. All right. I imagine we have launch. So, this is a troubling topic for our community. And as a result, we need answers to understand how it is that the medical profession can take care of us, because we are not all one type of person, but we are different. So the important thing I need to find out, first of all, is when we talk about equitable healthcare systems, What does that mean in practical terms for Africa and the Caribbean? Yvonne, you want to?
Thank you so much. When we're talking about health equity, we're just looking at how do we create a system of practices where everyone has fair access to health. And at present, that is not the case. We have communities where some people are living in rural situations and so cannot easily access care as someone who may be living in urban communities. And so when we're talking about health equity, it's looking at how do we give everyone the type of support that they need so that they can thrive in their lives and so their families can thrive. And so they can have the health outcomes that will allow for the sustainability of their family and also their communities.
Thank you for that. So this question is for Steve. So what are the biggest structural barriers that currently prevent fair access to quality health care in Africa and the Caribbean?
Okay, David, thanks. If I may just pick up, expand, equitable health care systems ensure that there are universal access to quality care without financial hardships. Africa and the Caribbean has sufficient health disparities, including high maternity, mortality, and infectious disease burdens, and rising non-communication disease.
You put it closer to your mouth. Yeah. It should be on. Just blow into it and see if it's on. Yeah. Yeah. You're live.
Yeah?
Yeah.
So just really picking up on what I'm just trying to clarify the position in regards to equitable healthcare systems. And it's really to ensure universal access to quality care without financial burdens. Because Africa and the Caribbean face significant health disparities, including high maternal mortality and infectious disease burden, and rising non-communication disease. I believe that the objective is around why equity in healthcare matters. And the challenge for us is to identify what are those key factors that are impacting us in the Africa and the Caribbean communities. These strategy pillars for building equitable systems is needed. And broadly, David, just before I hand back to you, I think one of the critical things that we need across the two communities is define healthcare strategies. And too often our political colleagues tend to play it along the political lines rather than the demographics. That's what the population needs. There are initiatives that are in progress, and it would be nice for them to be developed and shared across the two communities. David.
Thank you for that, Steve. You're quite right. You know, I think COVID might have been a good example of how the disparities exist and how they had impacted negatively the African Caribbean community in the UK in particular. I know there were challenges on the continent, and there have been several challenges in the Caribbean as it relates to how access to health care emerged through that period. And I think now that there's still some residual problems as it relates to how equitable health care is distributed. So, Dr. Nicole, how do economic disparities, geography, and social inequalities shape health outcomes? And what approaches are proving most effective in reducing these gaps?
Yeah, thank you for that. I think, can you guys hear me? I'm not sure if the mic's on. Thank you. Can you hear me now? Yeah. Perfect. When I think of equity, and I look at the Caribbean, for example, I mean, for decades, it's been a case where those who have can get, and those who have not really can't when it comes to health. For those people who are living in rural communities where they may have limited access to medical care, where they may have limited access to good physicians, where they may have inadequate numbers of nurses to care for the population, then we find it's really a lot harder for people to manage the care that's being provided to them and to manage their health also. And so when I think of access, I also think of their ability to afford the care that's provided. In some places, there is what we would call universal health care, but that health care is not necessarily optimal care. And so those people who can get good care are those who can pay for them. And if a lot of the population doesn't have a lot of money, then guess what kind of care they're going to get? Either not good care or none at all. And that's the challenge that's faced in so many communities. It's that people are living with non-communicable diseases like diabetes, high blood pressure, hypertension, even kidney disease, and they really don't know how to manage those conditions well because, one, they don't have access to the information on how to care for themselves, and then they don't have access to the specialists who can really help them manage the health condition that they're facing. And so what happens is people who are living with those conditions eventually develop the long-term consequence of not managing that condition, right? And for things like diabetes and high blood pressure, that might result in the development of chronic kidney disease, resulting in kidney failure. Now, who wants that? These things are preventable. They're actually very preventable if we recognize that there are inequities in our healthcare systems. And our leadership, our governmental leaders, have to prioritize healthcare, along with all the other things that they need to prioritize for the country. They have to prioritize the health of the individuals and of the communities. And then, too, communities have to really start working together to make sure that they're okay. So it's not a matter of waiting for the government to do something, but it's local people in the community. Communities have nurses, they may have community health workers, they may have people who have some limited experience in food service, and those people in local communities can decide together, we want to do something different for our community. And therefore start looking for the resources that will help people in their local community and then expand their reach to outlying communities so that care can be received by all. The reality of it, you guys, is that access is really important. Not only access based on geographical areas, but also access based on gender. We know that women are at greater risk for poor health outcomes. Why? Because they don't have access. They don't have the money sometimes to pay for the care that they need. Sometimes their access is controlled by their partner, who determines whether they will pay for them to go to the doctor, whether they will get to see a specialist, whether they will pay for them to have child care so that they can go get personal care for themselves. There's so many levels to this conversation that really we can only touch upon briefly in looking at this right now. But when we're thinking about health equity, it's really looking at the comprehensive way that we can address the health challenges that we face. Looking at our gender differences, looking at our economical differences, looking at our geographical differences, looking at our policy and system practices, because those are important too. The policies that are created locally, that are created federally also, those make a difference in whether we will have those programs that can support optimal health outcomes for ourselves and our family members. And then we also have to consider the systems that are in place, because policies will really impact what systems are set up that allow us to receive the care that we need. So it's really a comprehensive look, a view that we have to take in addressing health equity.
Comprehensive indeed, but I can't help but reflect on something that you said in terms of the government's priorities in relation to health equity. Because it would seem to me, and I'm not an economist, that there's a direct correlation between a healthy community and GDP growth. So why then would they not, and this is not on the script, why then would they not prioritize health equality as part of their mission to grow their nation or to boost their economies? Why do you think that they would not put that at the top of their priority list?
I think it's actually for many different reasons. The average person understands that their health is paramount in being able to function okay, and I do think that government, for the most part, I think they do prioritize it in a sense. But when it comes down to the hardcore dollars, that's really when you get to see how much of a priority something is. I think everyone in this room would admit that if we are not healthy, we cannot work. We cannot take care of our families. There's going to be high absenteeism from our employment. And I do think that governments recognize it's important to address that, but there are so many priorities. Some leaders of countries may prioritize infrastructure because they see the actual connection between putting in a highway and the allowance of passage for people to come and develop the country. But they're not necessarily looking at the intangible numbers connected to health. And that's the thing about health, it's that there is tangible results of investing in health, but it's also very intangible in a sense. And I don't think economists in many countries study the impact of health on the economy. Now, some places in the world, they do study that. But in the Caribbean, when it comes to anything related to health, the literature is very small. And the research that's done on the health impacts on the economy is even smaller. And so I don't think many leaders recognize that if they're going to invest in their people, one of the best things you can do is invest into health research, health policy implementation, and then invest in understanding how people working actually allows the country to grow financially. I think when they start investing in that type of research, I think they will make slight changes to the types of policies they implement and to how they fund the healthcare system.
Amazing.
David, if I may add to Nicole, just a couple of real-world examples. In Africa, Malawi's one plan, one budget approach for community health financing is one example. In Kenya, the Living Goods Partnership for Community Health Workers, Rollback Malaria, a maternal and child survival program. And in the Caribbean, we have the Jamaica example of the National Health Fund for Affordable Medicines, mobile clinics and telemedicine initiative in rural areas. And then there's the CARICOM disaster preparedness collaboration. So we're beginning to see some development, albeit maybe slow, but in the right direction.
Thank you for putting context to it, Steve. One of the things that I think is also important to note is the fact that there are many communities in Africa and the Caribbean that still practice informal systems of healthcare. I'm even wondering if because of the existence of these communities and probably the success rate of these communities taking care of themselves, that this could be one of the factors why governments don't prioritize health as part of their economic planning. But nonetheless, would you, and this question is for you, Steve, would you believe or would you think that there's a possibility that governments would integrate this informal health process that these communities exercise in their health planning at large?
I believe so. Some years ago, I worked with PAHO to do scoping as to healthcare strategy across the Caribbean islands. And at that time, we could not find a single Caribbean island with an overarching healthcare strategy. Now, things have moved on somewhat, but that is the direction, and particularly the CARICOM community-wide, so that whilst one particular island may not be able to afford certain specialist provision, but shade, as we have here in the United Kingdom, hospitals are called tertiary hospitals, because you may not get that specialist care in the area where you live, but you can access it to one of the specialist providers. And I think we're beginning to see that. Places like Barbados, the Queen Elizabeth, Trinidad, you have a number there, and Jamaica, you have more, and they have a growth in medical schools. So it's beginning to happen, albeit slow, but it is in progress.
May I add to that?
Sure.
I think also, I would say it's really important for us to work with people within the community level, because I think they best understand some of the things that minimize their ability to stay healthy. Community health workers are really well known for being able to understand the pulse, the health pulse in the community, and then create those programs that allow them to make a larger impact on the health of the local people. The governmental level, they understand healthcare at a policy level. And that's where they live, on the policy level. And then we go down a little bit closer to the systems level and how those policies affect the systems of care that are there. But in the local communities, that's where you get to see how people are actually living. When we're thinking of healthcare, and we're talking about public health here, and we're looking at healthcare, it's always from the individual outward. It's from the individual experience, and then we kind of move beyond the individual experience, because no matter how amazing the healthcare programs are that are out there, and no matter how well-trained doctors are, if people don't go to those programs, and if people don't see those doctors, they may still have a limited access in order to improve their health and their lives. And so I really think it's important for us to first start in the communities and have people start figuring out, what do we need in our communities to take care of ourselves, and then have those leaders at the local level help them figure out, how do you actually make the change that you need to change, you need to make in order to improve individual health. And then based on that work in the local communities, expand that upward to look at, well, what systems do we need to get in place to make care equitable? And then from the systems that are there, okay, what policies do we now need to create on the governmental level to make sure that the systems are there that need to be there to care for people, and then the people can get access to the care that they need.
Fantastic. Thanks for putting the whole thing in context, Dr. Lawrence. And I'm afraid we've come to the end of this exciting topic of health inequalities. I'm pleased that Drs. Steve Mango and Nicole Lawrence have been able to expound on the issues as it relates to how health inequality can impact African and Caribbean communities. And because of that, I say no more. Thank you so much.
Thank you.